Hi, I'm Nora Safadi.
My name is Ryan Feckrap.
And my name is Melody Shadinlow.
And this is صدای دانشجو. We're very excited today to have a guest, Dr. Amir Hossein Karimi. He completed his bachelor's degree at UCLA and his MD at Case Western Reserve School of Medicine, and he's now beginning his first year of anesthesiology residency at UCLA Harbor. And he has been a very special mentor to me over the past few months I've known him, and he works as a med school mentor and coach. So, hi. Welcome, Amir. Thank you for coming.
Hello.
Hi, thanks for having me. I'm really excited.
So the first question is something I'm sure you've heard all throughout your medical career so far, and I'm going to ask you again, but why medicine, and specifically why anesthesiology? What drew you to this career?
So medicine, just to be able to help people. I feel like I always want to help people, and the best way you can do that is medicine. You have the chance to save someone's life, improve them, prevent diseases. Like, one thing that a lot of people don't realize about medicine is the fact it can stop diseases from happening before it's too late. So I think that was the unique aspect of becoming a physician that actually drew me to medicine. And anesthesiology, honestly, like, I was always orthopedics, but I think during med school, I decided I wanted to have a better lifestyle, was still being very hands-on. Anesthesiology really gave it that best, like the greatest lifestyle balance in a way, where you're so very hands-on, you know a lot of physiology, where surgery is very anatomy-based, but anesthesiology is very physiology, knowing every system of the body, while also having family time next to it as well.
Yeah, that's great. So how would you describe just overall your medical school experience? Like, were there any challenges you faced, or anything specific you want to know about just going through it? I know we're all pre-med here, and we're all a little scared to get started.
I'm terrified.
Honestly, people make med school seem super hard. It's not that hard. They say you're going to be drinking out of a fire hose. Material isn't hard. The material isn't too much. Especially like most of us who did undergrad, I'm assuming we did really well in our science classes because it was easy for us to understand. So just easier for you to understand the content. You don't have to take French anymore, which I did. You don't have to take art history. So it's very
like art
science
history.
based with something. I didn't like it that much, but
Each their own.
yeah. It's very like you're something you're interested in, and again, most med schools have become pass and no pass essentially. So
Yeah.
it's not grade based. So the first years of med school is really really chill if you know how to study. I think that's the challenging part for me. I'm very old fashioned. I like lectures, I like going to lectures and everything else. But med school, like when you start med school, when you start any graduate school, you're on your own in a way. Like we had lectures, but out of the 200 people in our class, only 20 people actually showed up. But the lectures aren't the best quality. So you have to teach yourself everything, whether in med school or in residency. Like one of the things I would ask in my interviews was, well, what are the lecture styles? What are the didactics like? And most schools will say we don't have that often, I mean, maybe once a week. So I think that was the biggest challenge for me in med school, was to learn to study on my own and like learn the material on my own without the lectures that I'm used to.
So just as a follow-up, were there any experiences you had as a pre-med, maybe challenges, or just anything you feel prepared you for medical school?
I feel like, see, I'm an immigrant, so when I came to the US, there was a lot of bad information around like how to apply to med school. So I think that's the hardest part, to figure out what's the good things to do and what the wrong things to do are. I went to my pre-med college advisors. One major tip: don't go to your college advisors.
Oh,
Check
yeah.
Reddit. They're much better and more resourced than your college advisors. Just like, he told me to have three activities: a volunteer work, hospital work, and a research experience.
That's
And
awful.
that's awful. Yeah. January of my third year, when I was thinking about applying, I was like, okay, it has 15 activities. I have to scramble around to do something. I think that was the hardest part, like the amount of wrong information. I was told, like, if you can smell a patient, that's considered clinical experience. So I did like 300 hours of patient transport.
Oh.
Yeah, patient transfer isn't going to stand out on your resume. It's not clinical experience. So I think navigating through that, figuring out what's the right steps to take and what are the wrong steps to take are the skills you will need, especially in med school. Figure out which is the right mentor and who's not a right mentor for you, which activities to be involved in and which not. I think that's a unique skill you will get during undergrad that you can apply to med school.
Amir, this is Ryan. I have a question for you, sir. What are so we're pre-med here. What are the important questions that we need to ask to medical schools. So let's say we are among the fortunate who get selected for interviews. What are some, I don't care about impressive questions to ask the admissions committee and the interview committee, but what are some smart questions to inform myself, is this program good, you know?
That's a great question. Honestly, I think the most important thing is ask about how often they have exams. Like my school was great where I had exams once every 3 months. For the first 2 months, I would legit not do. My friends and I would just go out, have fun after every class. The last month, we said, why did we waste our 2 months and scramble around and study for the exams? But I have a friend, for instance, she's doing a DO school, and she has like a weekly quizzes, 3 different weekly quizzes every week. And you don't want to do that. You want to enjoy med school. And if you want to have, and her school is very grade based. So like, again, ask whether it's pass or no pass, whether it's grade or not. A lot of schools don't even have the pass no pass. You have to write an essay saying why I should go to the next level next semester in a way. Another question would be is how are your, again, this is the first 2 years of med school, how are your clerkships graded? For instance, our school, we have shelf exams and this counts for like, if you want to honor your exams, you need to get a 50 percentile and higher up. And that's a very, very hard score. That's nationally, not even the school. So it's nationally is essentially a step 2 score of 250. So that's really, really hard. A lot of schools might have 30 percentile. I know the University of Chicago has the 80 percentile.
How aware are your residency programs of the situation that was at your school? Like it's pretty.
They don't care.
They don't care. There you go.
They don't care. Like when the school sends our letters to them, our dean letters, it's 16 pages. Trust me, they have 1,000 applicants. They're not going to go through every single page reading how the grading system are for the school. It doesn't really matter. Try to choose a school that you know you can honor, especially if you're going to a competitive specialty. Again, it's better to go to maybe a lower name school but honor everything compared to the University of Chicago. You might need a 60 or 70 percentile on those shelf exams to honor them, for instance.
Last follow-up. Yeah. What are the major points that do matter for residency interviews?
I just got through that residency interview, so I'm
so sorry.
Sure what you're, no, I don't know what
if you need to take a moment,
exactly.
Take a moment. It's okay.
But I think just see, if you're going to a competitive specialty like orthopedics, neurosurgery, is your honors, how many honors you have, and your research activity. Those are the 2 biggest things that make you stand out. For less competitive specialties like internal medicine, for instance, they don't really care how many honors you have. Again, if you have more, the better it is. Having some research is good. It's just like how involved you were in your school, how many activities you have in your school, how well you wrote your personal statements. I think that's the bigger part that plays into the less competitive specialties. And again, speaking of why people want to go to top 20 schools, top 20 school doesn't mean better education. My school, again, is a top 25 school. And we, out of the 200 people, 30% of the class didn't match. 25 people didn't match. That's a large number of people that didn't match in the first round. And they had a SOAP to match in. So like school name doesn't really matter. What does top 20 mean? It means like they have a lot more research opportunities. Yeah. So like Case Western, for instance, has 3 major hospitals. It is attached to 3 different hospitals. So you can do research at any one of those. That doesn't mean if you go to a smaller school, if you go to a DO school, you're not going to do research. Research is going to be a part of every school. It's just the amount of research you can do. But again, I think one of the biggest things in med school is that you have to show the initiative to do research. Like most of my publications came out because I worked with a mentor. He didn't care what we did. He said, you guys come up with ideas, you write the paper, and I will just submit it for you guys. So that allowed me to publish 40 papers in the last 4 years.
Wow.
So I got involved. Like I went on PubMed, saw some ideas from other institutions. I found a doctor in Iran, for instance, who was doing research in orthopedics. So I emailed him, worked with 3 or 4 papers with him. So essentially, even if you go to a DO school, if you go to a smaller MD school, it doesn't mean you can't get into a competitive specialty. It just means you need to put a little bit harder work into it to find those opportunities.
Okay.
Right.
Thank you.
Yeah, thank you for that. And I know you run a mentorship company and you help specifically with med school applications. So I was wondering, what are a few things that you think, and I know a lot of people think of it kind of as a checklist, which isn't the correct way of thinking of it, but what are a few things that pre-med students really need or that they lack in their application from what you've seen?
Surprisingly, a lot of people lack the clinical experience. So a lot of people don't realize how hard it is to get actually good clinical experience. If you want to become a medical assistant, for instance, and here in California, you need to be licensed unless you're waiting to work for a doctor for free or anything like that. So getting the proper clinical experience is really, really hard. It's not impossible, but a lot of the students might have only one activity on their checklist, and they might have worked 1,000 hours in it. But like my point to them is always, when you want to write your personal statement, when you want to talk about why medicine, how are you going to talk about only one experience? So I always say people say it's quality over quantity. It's both. It's quality with the quantity as well. You need to make sure you have enough strong clinical experiences, strong communities. Again, community service is not everybody's thing, but having it isn't a bad thing on your resume. Have some research. You don't need to publish anything, because most people know undergraduates who publish anything aren't the strongest papers. Like they just publish it. I never read the publications when I was in an interview team at Case Western, for instance, but I just didn't care. I preferred the more fun activities, your hobbies, your clinical experiences, which I can learn more about you guys. And most important when it comes to writing your application is write stories. Like everyone knows what a medical assistant does. I don't need you to tell me I took vitals, I took the patient's history. That should be just one sentence. Give a story about a patient interaction you had and how you dealt with it. For instance, when I wrote my medical assistant experience, I talked about taking vitals from an ADHD patient who was like 10 years old, was moving around a lot. I talked about how I tried to calm the child down, how I tried to distract him, try to talk to him. And again, that showcases my skill while still showing I'm a medical assistant.
Yeah. This is a chance for our viewers to evolve their mental skill set. As pre-scientists and doctors, we have this very factual and empirical way of thinking, but it's almost like how a historian would approach a narrative. Once you know the facts, we're looking for, from your perspective on admissions, the why, the thought process, the thoughtfulness, and the conscientiousness that goes behind that narrative, so that we may conceptualize this person as a doctor. Like, can I see this person from how and why they were making these decisions as a doctor, potentially?
Yeah, that's exactly it. And honestly, you don't need to power into my head that you want to be a doctor. For instance, I did this mistake when I was writing my working activity. I talked about how I was a soccer coach because I liked soccer. I taught people. Then my reflection for that was, I'm going to use these teaching experiences to teach my future patients about their health management. Like, I get it. You told me a story. You're a great teacher from your story. Don't relate it back to medicine. Exactly. Just like talk about what you learned about teaching. Like, teaching is about instilling confidence in your students, so they have the ability to learn on their own. Like something that's unique, that's more reflective, that tells you, okay, this person has a unique understanding about teaching. And honestly, it makes a major difference when I compare different essays. I as a student reading these interviews or reading these applications, it makes me like, I want to actually talk with this person. This person isn't trying to kill me with it. I want to be a doctor. I want to be a doctor. He's talking about things he or she is interested in, why he did it, all of that, compared to someone who's all about medicine. When my students start writing their secondaries, for instance, I say, you talk about medicine for your primary application, you talk about it in your working activity, you talk about it in your personal statement, talk about other things, talk about anything else you might be interested in. Because you're more than just a medical student, you're a doctor, you're a human being. Show what other interests you have and talk about those.
So this is a sort of related question, but what would you say is the biggest mistake a lot of students make in their applications?
Again, I think there are two mistakes people make. First of all, trying to shoehorn why they want to be a doctor, like try to put it in every single paragraph, in every single story. It's just like sometimes a teaching experience is a teaching experience. You don't have to relate everything back to medicine. And secondly, this is more about the personal statement and your secondaries. Make sure you answer the prompt. The prompt for the personal statement is why medicine. A lot of my students would start writing essays about some unique skills they showed or what amazing abilities they have or accomplishments they have. But eventually I'll ask them, what was the point? Like, did you show why medicine? Did you tell me why you're interested in medicine? Like I say to people, like, have three stories, 5 paragraphs, 3 stories, whatever. And in each paragraph, you should tell me or show me a certain understanding about medicine and why you want to go into it. That you're actually answering the prompt. And similar things with the secondaries. For instance, a school might ask you, what skill sets would you have to bring to the university? And students will say, this is why I want to come to this university. Yale has this aspect. I want to learn more about it. Well, like, that wasn't the question. The question was, like, what are you going to bring to Yale? Not what will Yale give to you, for instance.
Right.
So I think just making sure to answer the prompt is a major mistake a lot of students do.
That makes sense. And so if you were to give one piece of advice to pre-med students just now starting their journeys, what would it be?
I think just enjoy life. Like, don't make medicine your entire life,
That seems
honestly.
to be a theme
Yeah.
that we've gotten from
Yeah.
every doctor, every med student we've brought on.
Yeah, it's just I was that pre-med. Like, I was a pre-med who just for 4 years of undergrad and like 3 years of gap year, I just did medicine. Like, I didn't go to the gym, I didn't take care of my health, I didn't do fun activities. And like now I'm on the other side as a resident, and I regret it. I say I missed out a lot of fun activities I could have done in undergrad, some of the life experiences I could have gotten in undergrad because I sacrificed so much to get into med school. You remember, med school, doctor, physician is just a career. Some people make it their life. I know a cardiac thoracic surgeon at like Cleveland Clinic, for instance. He worked 14 hours a day and he was happy. He said, this is my job. This is my love. I have 3 kids, but I'd rather be at work. So like he loved that aspect of his job. Most people aren't like that. It's a career. You don't need to have a 4.0 GPA and 522 to get into med school. If you really want to be a doctor, there's multiple ways. MD schools, top 20, top 100 doesn't really matter. You're still a doctor. DO schools, you're still a doctor. You can do any specialty you want. You want to go Caribbean schools? If Caribbean schools are harder to survive out of, I would say. But if you do go through it, I have a friend who went through it with his wife. He got into anesthesiology at University of Florida. His wife got into emergency medicine. Like, if you really want to be a doctor, there's always ways. There's multiple routes. Going abroad isn't a bad idea either. So if it's something you're really passionate about, don't overthink it. Just enjoy life and work towards what you want.
Wow. So, did you have a question?
There was
Sorry.
discussion before the show went on that perhaps there was a down-putting atmosphere around this gentleman. That was a very uplifting speech. Yeah, never give up, and you have options. If this is really for you, you have options. So thank you for that.
Yeah, no, the only reason I said that is because the first time I met Amir, he was giving a talk on med school admissions, and that was when I was working on my applications. And
Yeah,
it
it's
definitely,
stressful
it was a stressful time.
Yeah.
He's amazing. He's a great mentor. He's very insightful. So yeah, thank you for that.
Thank you. No worries. Thank you.
So there is a lot of pressure, especially in the Iranian community, for what career you want to go into. And I know you worked with a lot of students, and with you yourself, you're an immigrant. How do you really decide that this is something that you want for yourself and not necessarily like for your family or for the community?
Just be honest with yourself. Sit down and ask yourself why are you doing this? Why do you want to go to med school? If it's true to help people, there's multiple ways to help people. You can become a social worker and help people. If it's a career, there's a lot of other careers. If it's job, money, there's a lot of other aspects that have those aspects, like money in it, financial stability, all of that in it, without you having to go through 12 years of education to get it. But just be honest with yourself. Is this truly what you want? Is this why are you doing? Ask yourself why you're doing this. And if you actually have a proper answer for it, then do it. Shadow doctors. I know I shadowed a lot of doctors. They told me don't do medicine.
Yeah.
I'm assuming it's going to be the same for a lot of people.
Yeah.
But just shadow doctors. I think the most important thing is I had a mentor in medical school. He told me, don't follow your passion. I know this sounds bad, but let me get to a straight point. Whatever you're passionate about, after 10 years, 20 years of doing it, you're going to get bored and lose interest in it. But do something that you see yourself living a life in. And that's the most important thing. Ask yourself, as a physician, would I be able to live the life I want to live?
Right.
And that's the most important thing. If you can't imagine, in 12 years of education, that's the minimum. A lot of people take gap years. A lot of people do longer residencies, do fellowships afterwards. Just 12 to 15 years minimum to become a doctor. Are you willing to sacrifice your life for that? I mean, that's a major thing to ask yourself as well.
Yeah. I'm just curious, have there ever been times that you've personally doubted the path or what you're doing, even along the way?
I think med school really was that. First of all, again, I think a lot of people don't know about this. I applied 3 times. So First time I applied, didn't have a great MCAT score. Second time I applied, I had a 522 MCAT score, but my essays weren't great. So the third time I applied, I fixed the essays, fixed my interview skills. I eventually got the interviews and acceptance I needed to get into med school. So it was hard. That was a lot of setbacks to not getting in twice, especially with the second time when I had a 522 MCAT, 4.0 GPA from UCLA. But again, if you're passionate about it, no matter how many setbacks you get, again, there's always a way to get into med school. What I regret now is that I should have applied to DO school this first time or second time. I would have been maybe a practicing physician right now. Again, I know the Persian community is all about, what, do MD, you want to be the best of the best. But honestly, like 10 years from now, 15, 20 years from now, when you're a doctor saving patients' lives, no one's going to care about whether it's MD right next to your name or a DO right next to your name. I think that's, just be honest with yourself. Just choose a path. If your physician is really what you want to do, choose a path that makes sense for you.
Yeah. So for those who are listening who might be feeling overwhelmed or are doubting themselves, what's a piece of advice you would leave, or what's a message you want to leave with them, just to wrap things up?
Don't compare yourself to other people. I know how hard that is when you start comparing to other people. Say, oh, this person has this research. This person has a higher MCAT, higher GPA, or like this person, again, when I applied, I had friends who had lower GPAs and lower MCATs and got in the first time, and then compared to me. And that's hard. It's hard when you see other people as being successful and you not, but like everybody is a different journey. Everybody's on a different path. And honestly, I always tell this to people, like, yeah, it was hard not getting in 2 times and applying a 3rd time, and it was expensive, honestly. But I'm glad I didn't get in the first 2 years, because I had to move away from my family for the first time, live on my own in Cleveland, from all places. And I don't think I was ready after undergrad. I needed some time to grow up, mature. And again, I wanted to stay with my family. But moving away from them was, again, a good life experience. I'm back close to them right now, so I love it. I'm a family-oriented person. But I still think that's a good experience to have, to be independent, to live on your own. And everything worked out well. I met some great people who are like-minded like I am. We hanged out all 4 years of med school. So I always say, it was fate. It was meant to be. So like, don't compare yourself to other people. You're on your own journey. You're on your own path. Stop comparing yourself. Just be yourself and be happy.
Yeah, that's really nice to hear. As a pre-med, as all of us are, I know it's very easy to get wrapped up in everything, but it's very important to, take care of yourself and to give yourself that grace. Is there anything you wanted to add or share? No?
Throwing enough questions out.
I just wanted to say I really admire your journey and like how you've been able to overcome obstacles. I know we've talked a few times before, and the advice you've given me and the advice you've given others, like I will definitely carry that on with me and try to remember to enjoy life a little bit to the best of my ability as a pre-med. But anyways, thank you so much, truly.
I'll check your coaching price points, and you may just be seeing me very soon.
Sounds great. Yeah, it's medpat-consulting.com. So again, people can have my Instagram. I don't mind, as AmirHK7. If you need to message me or anything, I'm happy to help out. Honestly, I've been in your shoes, which is why I started a mentoring company. I like teaching and like mentoring people. And honestly, just message me. I'm happy to help and with any questions, honestly.
And I just want to say, you've been so generous with your time, with your knowledge, with your experiences, and I just really appreciate that you're always so willing to share your insight and help other people, even when it's not necessarily serving you any benefit. You're just doing it for the greater good, which just shows how good of a doctor you'll be very soon.
Thank you, sir.
Thank you. Thank you.
Yeah.
And honestly, try to replicate it. Like I tell people, like when you start residency or like when you start becoming med students, just to take care of yourself, take care of other people who are trying to be on the same path. It might be a lonely path, but like if everybody tries to help each other out, it will make it a much easier path.
Yeah, absolutely. So thank you so much for coming on. We really appreciate it, and I hope you have a good one. Okay. Well, I personally found that very helpful. It kind of puts me at ease to see these very intelligent, 522, 4.0 GPA.
We forget people get in IMG.
Right.
Yeah.
You heard that? The Caribbean medical students. So, there's an ethos that Caribbean schools will accept anybody with a pulse, but at the same time, you hear match results. Right? So there's possibility. Like, I personally have not seen this. I've heard horror stories. People that don't get in 2-3 cycles and then they have to pack their sunscreen, right? They get in. There's a silver lining.
I think it shows like everyone has their own path. Everyone's path looks different. like Amir said, like we shouldn't be comparing ourselves because we
No,
all have
absolutely
our own path. We're all
not.
unique in our own ways, and at the end of the day, you're gonna get to that same.
Right. There's no like cookie cutter, straight, direct
Yeah.
path way that you're supposed to be or become a doctor or the kind of doctor you're going to be. Everyone is very different. Every experience is very different. You could end up at a DO or an MD or in another country.
Yeah.
I know people who did American programs in other countries and returned back to the US for their residency.
You'll have to tell us more about that.
I know very little, but maybe we can bring them on for another episode. Thank you all for joining us today, and we will see you next time.